Who doesn't love a fairy tale and all the happy endings? It's what we all want, love and happiness. And then again, there's real life. Let's talk about the dream and the reality. But first, let me introduce myself, because if we were in a classroom, Mrs. Bennett would have already done that. My legal name is Benita Katz, but you can call me Bonnie or Mrs. Katz, whatever you're most comfortable with. You can see my business name and contact info here. I teach about pregnancy, birth, newborns, breastfeeding, pretty much anything that has to do with getting a new family off to a good start. I absolutely love what I do. In addition to the business of teaching, I'm a strong advocate of giving back to my community, so I serve on the hospital board of trustees and on the board of the Wyoming chapter of Postpartum Support International. On a larger scale, I'm currently the president of the International Childbirth Education Association. Usually I don't go into all of that. Mrs. Bennett does that for me. But I want you to understand that although all of that sounds really important, at heart, I'm a stay-at-home mom, just a regular person. I'm telling you all of this, though, to help you understand that even ordinary people can make a big difference if they really care and are willing to do the work. Now let's talk about you and that happily ever after. First, something I know you've heard before but bears repeating: don't depend on another person to make you happy. Every person I've ever met is human, which means that from time to time they fail. They disappoint you, they make you angry. And that said, there are some really wonderful people in this world. So what characteristics are you looking for in the person that you want to spend the rest of your life with? These are a few of the more common responses that I get to that question in the classroom. Someone who is honest and kind and has a good sense of humor. But I want to add one more quality for you to consider: skepticism. Skepticism is not cynicism. Cynicism is hard-hearted. Been there, done that, you can't tell me anything I don't already know. Skepticism is skeptical. It's questioning. It's not the enemy of belief. It says, help me understand. How do you know that? No one knows it all, and even experts make mistakes. So it's important to be able to think for yourself. So I'm going to ask you to be skeptical. Be skeptical of what society tells you. Maybe you'll agree, maybe not. But at least to ask the questions so that your decisions are your own. Instead of sitting there listening to me, and I'm sure you're all being very attentive, think about what I'm saying and be skeptical. So this is a piece about what love is. I got it offline a couple of years ago, but I think it really nails it. Not the Hallmark kind of love or the sexy, steamy version of love, but real life version. Listen and tell me what you think. This is what your knight in shining armor looks like when you're in your 40s. Yes, that's my amazing husband who is arriving on the scene with his credit card, because what you can't see is me standing next to a cart super full of groceries that I couldn't pay for because I couldn't find my wallet. Not sure you can tell, but he's smiling at me. Yep, he had to leave work and he is smiling. His only words of admonishment were, "You're not supposed to be grocery shopping. I said I'd go this week." Seriously, this is what love looks like when you're old, and it's ridiculous how awesome it is. Love also looks like me coming downstairs to a full pot of coffee every morning, because coffee is love. Love looks like all the lunches being made so I can enjoy that aforementioned cup of coffee. Love looks like someone washing all the dishes while his wife catches up on This Is Us while plopped on the couch and not helping at all. Love looks like a super patient dad doing the 5-year-old's homework with him every morning so I can get to work on time. And you guys, there were signs it would be this way, so I have tips for you. In college, this love looked like boyfriend Todd running to the store for a Danish I was craving, or watching me and my friends on the dance floor long after he wanted to leave, or him being known across campus by the flower backpack he was carrying, which, of course, was mine. So listen, don't be fooled by big showy proposals and giant cards with candy bars glued to them. That isn't stuff that lasts, and let's be honest, moms are totally helping them with those things. Watch how he treats you when Instagram isn't looking. That's where the signs are. Choose the man who will carry your too heavy flowered backpack in public, because he will also be the man who bails you out at Aldi's when you're 40-something with a smile and a hug. That, my friends, is true love. And true love often leads to babies. So, since that's my particular field of interest, let's talk a little about those little ones. Although you may not want to have quite this many all at once. This picture was just so sweet, I had to find a place to sneak it in. Let's talk about birth control. First thing, taking any kind of hormonal birth control and smoking is dangerous. I actually knew a 19-year-old woman who was hospitalized with a stroke for this very reason. There are other options for birth control, or better yet, do everything you can to stop smoking or vaping. Some substances can interfere with the effectiveness of hormonal birth control. So for instance, if you go into the doctor's office with a sinus infection and they prescribe you antibiotics, for as long as you're on those antibiotics, that hormonal birth control is not going to be as effective. The other thing to keep in mind is how regularly you take the pill. Ideally, you want to take it at the same time every day. The less regular you are, again, the less effective the pill is going to be. Also, if you use some substances like vitamins or herbs or any kind of nutritional supplement, if you use it as a medicine, treat it as a medicine. Medicines can interact with each other. Just because it's natural doesn't mean it doesn't have side effects. Always check with your healthcare provider. As for barrier methods, lubricants can interfere with different kinds of barrier methods. There are two main categories of birth control: barrier methods like condoms and diaphragms, and hormonal birth control. Barrier methods of birth control work by forming a barrier between the sperm and the egg. Hormonal forms of birth control work in one of these 6 ways. A mechanism of action is the medical term used to explain how a drug works. The pill, NuvaRing, the patch, depot shots, and some IUDs are hormonal contraceptives. They all work in one or more of these ways. The first 4 things on the list keep the sperm and ovum or egg apart, preventing fertilization. The last 2 things occur after fertilization has taken place, preventing development of the zygote. If you believe that life begins at conception, this is problematic. The cervix is this lower portion of the uterus. Sperm must first pass through here and travel through the uterus to the fallopian tube in order to fertilize the egg. Most fertilization takes place out here in the outer third of the fallopian tube. When this cervical mucus is very thick, it makes it more difficult for the sperm to get through. And if it cannot reach this upper reproductive tract, then conception is less likely. The second mechanism of action is to prevent ovulation. If no egg is released from the ovary, conception is impossible. Preventing capacitation of the sperm is the next mechanism of action. Capacitation is simply a biochemical process that must take place in order for the sperm to be able to fertilize the egg. Without capacitation, fertilization cannot take place. The fallopian tube is lined with cilia, in a different form but with much the same purpose as that the cilia has in our respiratory tract and our intestinal tract. The cilia help move things along. When the movement of the cilia is inhibited, it slows the sperm's progress through the fallopian tube. Although the sperm may be viable for 3 to 5 days, the ova or egg is viable only for 24 hours. If the sperm doesn't reach the egg within 24 hours of ovulation, the ovum cannot be fertilized. Fertilization cannot occur. Each of these first four mechanisms of action prevent conception. The sperm and the egg have not united. No zygote is formed. For those who believe that life begins at conception, the last two mechanisms of action are problematic. In the same way that tubal motility inhibits sperm transport to the egg, it also inhibits the zygote's ability to travel down the fallopian tube to the uterus. Around day 6 to 8 after conception, the zygote requires the nutrients that the endometrial lining of the uterus supplies. If the zygote does not implant in the lining of the uterus at the proper time, it will not survive. The last mechanism of action is to induce endometrial atrophy, meaning that the endometrial lining does not thicken with the blood and mucus necessary to nourish the zygote. An atrophied or thin lining of the uterus cannot support life. So if conception occurs and the zygote travels down the fallopian tube to the uterus, there will be insufficient nourishment for the zygote and it will not survive. If you believe that life begins at conception, then these last two mechanisms of action are early abortions because they prevent the continued development of the zygote. So let's move on from birth control. Let's talk about when you've decided it's time to have a baby. I'd encourage you to plan ahead. Develop a healthy lifestyle. Eat right, exercise, all those good for you things. Preparation for a baby ideally begins before you are pregnant. These are the typical healthcare providers for women when they are pregnant. CPM stands for Certified Professional Midwife. She is not a nurse and cannot work in a hospital. She attends births at home or in birth centers. She must pass the NARM exam to receive its credential. CNM is a Certified Nurse Midwife. She's a registered nurse who has her master's degree in midwifery. She can attend births at home, in birth centers, or in hospitals. Most CNMs do work in hospitals, and she has to pass the ACNM exam to receive this credential. A family practice physician is a family practice doctor with additional training in obstetrics. And an obstetrician, or you've probably heard the phrase OBGYN, which stands for obstetrician gynecologist, is a physician who has specialized in this field. Early and regular prenatal care helps in several ways. You have time to develop a trusting relationship with your healthcare provider. It gives you time to ask questions and learn what you need to know for a healthy pregnancy and birth. Remember that definition of skepticism? Keep in mind that not all hospitals, not all healthcare providers are the same. Each one has their own experiences and education, their own personality and preferences. Don't be afraid to shop around a bit and find the one that is right for you. Here's a bit of birth trivia for you. The rate of cesarean births in hospitals in this country ranges from 7% all the way up to 70%. Now, if you were wanting to not have a surgical birth, which hospital would you go to? Be skeptical. Ask those questions. What's the first thing most people think of when they think of childbirth? Pain. And it's what you see in this picture, isn't it? But what's the matter with this picture? If we were in a classroom, I'd give you some time to think about it, but since we're not, here you go. All we can see here is that this woman is alone. There's no one here to encourage or support her, and that makes a huge difference when you're having a baby. Secondly, she is in one of the most painful positions you can be in to have a baby. Yes, this is what you see most of the time in movies and TV, but this position actually causes mom more pain. So here's a plug for prenatal care and childbirth classes. There are many other positions for birth, some of which will help labor move faster and be less painful. Now, I didn't say pain-free, but definitely less painful. And one more thing, this is pain with a purpose. Think athletics, not injury. Just like when you train in athletics or dance, you experience some pain, but the end of the result is that you become stronger or more flexible. There's a reward at the end. It's not the same kind of pain as the pain from an injury. In the same way, the pain of birth comes with a wonderful reward at the end, a baby. I want you to see these pictures because these are scenes we don't see on TV. What emotions are these people experiencing? How does this compare to what you usually think of when you think of birth? Consider this. What you see on TV or other media has to be dramatic or it wouldn't be a story. Most birth experiences take a lot of hard work, but it's not all agony. So, how do dads react to birth? It's emotional for them too. There are no right emotions to feel. Some will feel tremendous joy. Some will feel overwhelmed. Some will simply feel relieved it's over. However it feels for you, the fact is that birth is as much an emotional experience as it is a physical one. Birth is more than moving the baby from the inside to the outside of mom. Birth is an enormous milestone in life, and that requires a lot of adjustment, physically and emotionally. Take a few minutes to think about these questions. Is pregnancy a normal, healthy part of a woman's life? Is birth a normal, healthy part of a woman's life? Now consider, 1 out of 3 women in the US has a cesarean. Now, cesareans are life-saving when they're necessary, but studies have shown that about half the cesareans performed are not necessary. See where the skepticism comes in? Ask questions. Find out how many cesareans are done in your area. Although the US spends much more than any other country on maternal child health, we have some of the worst statistics among industrialized nations. Why? Well, I'm glad you asked. That shows that your skepticism is starting to kick in. I'm hoping it makes you willing to ask questions when you start a family. I'd love to go into some of the reasons behind these statistics, but you really don't want this video to last much longer, do you? I'd love to tell you more about actually having the baby, but for that, you'll have to sign up for child development next year. For now, I'm just going to throw out a couple of ideas about what is good for baby. First, keeping baby skin to skin after birth. Moms and dads can both hold baby skin to skin. It helps regulate baby's heart rate, breathing, and temperature. Even baby's glucose levels are more stable when held skin to skin. Consider it a long, gentle hug that helps baby feel welcomed into this world. It's calming and soothing, not just for baby, but for mom and dad too. Secondly, consider breastfeeding. There's no way you can read all the things on this list, but just note the difference in the length of the list under breast milk and the list under formula. Human milk is made for human babies. And even more amazing, moms make milk tailor-made for their specific baby. How cool is that? It's a good idea to take a breastfeeding class. It would be different if we lived in a primitive culture where we saw women openly breastfeeding their babies every day, but we don't. Even when we see a mom feeding her baby in public, she's usually covered up to some degree or another. You may be wondering, if breastfeeding is natural, why do you have to learn anything? Well, breastfeeding is natural, but it's not natural like breathing is natural. You don't have to think about breathing, you just do it. Breastfeeding is natural like walking is natural. You want to do it, but first you have to learn how to stand on your own, and then you have to learn how to take a step or two, but you fall down all the time. Eventually you get the hang of it, but it takes practice. So go to a class. Find some good support for breastfeeding. Women who have trouble breastfeeding, most of them, either haven't had good support or they've been given incorrect information. So why is breastfeeding so important? Why am I making such a big deal of this? I'm so glad you asked. This information comes from the American Academy of Pediatrics. Compare this number to the number of children that are saved using car seats. Now think about it. This says that about 900 infants every year could be saved if 90% of mothers breastfed for 6 months. So that's not every mom. There are some that have issues and have difficulty, but 90%, that's a reasonable expectation. So what's interesting is if you cannot leave the hospital without having your baby in a car seat, because we know that saves babies' lives. But if you look at the National Highway Traffic Safety Administration, they estimate that 400 to 500 children under 5 are saved every year by using car seats. So this was 900 infants, which means a year or less. And the car seats save 400 to 500 children under 5. So breastfeeding makes a huge difference for babies. And I won't go into it here, but it also has a tremendous impact on mom's health as well. BFHI, that stands for Baby Friendly Hospital Initiative. It promotes, protects, and supports breastfeeding. It took Powell Hospital 8 years to become baby friendly. It means we support and encourage breastfeeding because it's so much better for baby and for mom. I just want to make sure that you understand it's not just a warm, fuzzy phrase. Baby friendly, every hospital should be baby friendly, right? But it's actually a designation that you have to earn. And right now, Powell Hospital is the only baby friendly hospital in the state of Wyoming. Well, I could spend hours talking about the 3 points on this slide. Physical changes include major hormonal shifts that affect mom's emotions. Lack of sleep also contributes to mood swings for both mom and dad. Relationship changes, oh my goodness, husband and wife become mom and dad. Parents become grandparents. It's new territory for everyone. Communication is key. Practicing good communication skills now will prepare you for this very sensitive time of life. This is something you can do now that will make a big difference in your happily ever after. Wow, we have covered tons of information here, and I have only skimmed the surface. I'd love to answer your questions. Thanks for listening. Stay skeptical. Have a great rest of your day.